Vitamin D is a crucial nutrient that plays several essential roles in the body. It is a fat-soluble vitamin that is unique because it can be synthesized by the body in response to sunlight exposure. Vitamin D helps regulate the absorption of calcium and phosphorus, which are vital for maintaining healthy bones and teeth. It promotes the formation and mineralization of bone, making it essential for bone growth and development, as well as the prevention of conditions like osteoporosis. In addition to its role in bone health, vitamin D is involved in various other physiological processes. It supports proper immune function, helping to defend against infections and promoting a balanced immune response. It also plays a role in cell growth, modulation of cell differentiation, and reduction of inflammation. Vitamin D receptors are found in many tissues throughout the body, indicating its widespread impact on overall health. While sunlight is the primary natural source of vitamin D, it's important to strike a balance between sun exposure and the risk of skin damage. Factors such as time of day, season, latitude, skin type, and sunscreen use can affect the amount of vitamin D produced in the skin. Generally, spending a brief period of time outdoors with unprotected skin exposure to sunlight can be beneficial. However, in regions with limited sunlight or during the winter months, it may be challenging to obtain adequate vitamin D solely from sun exposure. When it comes to dietary sources, vitamin D is naturally present in only a few foods. Fatty fish like salmon, mackerel, and sardines are excellent sources. These fish not only provide vitamin D but also offer beneficial omega-3 fatty acids. Cod liver oil is another notable source, but its strong taste and high vitamin A content should be considered. Some fortified foods can contribute to vitamin D intake as well. For instance, milk, orange juice, and breakfast cereals may contain added vitamin D. However, it's important to check product labels to determine the exact amount. Vitamin D deficiency can lead to a variety of health problems. In children, it can cause rickets, a condition characterized by weakened bones and skeletal deformities. In adults, a lack of vitamin D may contribute to osteomalacia, which is a softening of the bones, leading to bone pain and an increased risk of fractures. Moreover, vitamin D deficiency has been linked to an increased susceptibility to infections, autoimmune diseases, cardiovascular diseases, and certain types of cancers. Additionally, low levels of vitamin D are associated with mood disorders like depression and seasonal affective disorder (SAD). Certain populations are more prone to vitamin D deficiency. Individuals who live in regions with limited sunlight, older adults with reduced skin synthesis capacity, people with darker skin tones, those who cover their skin for cultural or religious reasons, and individuals with conditions that impair fat absorption, such as Crohn's disease or cystic fibrosis, are at higher risk. Additionally, individuals with obesity may have lower vitamin D levels due to its sequestration in adipose tissue. If you suspect a deficiency, a blood test can measure your vitamin D levels. The optimal range may vary depending on the reference values used, but levels below 20 nanograms ml, 50 nmol/L are generally considered deficient. In cases of deficiency, supplementation may be recommended by a healthcare professional to restore adequate levels. The appropriate dosage will depend on the severity of the deficiency and individual factors. Vitamin D supplementation is available in various forms, including capsules, tablets, and liquid drops. In conclusion, vitamin D is a vital nutrient for maintaining bone health, supporting the immune system, and regulating various bodily functions. While sunlight is a primary natural source, certain foods can contribute to vitamin D intake. Recognizing the dangers of deficiency is crucial to prevent associated health problems and ensure overall well-being. Regular exposure to sunlight, consumption of vitamin D-rich foods, and, if necessary, appropriate supplementation can help maintain optimal vitamin D levels for optimal health.